your endothelial cell, or excuse me, if you have a cut in your blood vessel, everything we just talked about is going to save your life. It's a miracle. It's every one of those little steps. The large macromolecules crossing so they can pull more fluid into that tissue for a faster immune response, pulling the white blood cells in, constricting the blood vessel, triggering the platelets to clot. All of that is timed so precisely so that when you get a cut, you don't bleed out. It is fascinating. However, when you do that in a situation for which that process is not designed for, such as you damage one part of the vessel, but the rest of the wall is fine, that whole process, which is amazing to keep you alive, all of a sudden breaks down and creates problems. So here's what we have. We have the vascular endothelium. Here's the smooth muscle tissue down here. So vascular endothelium, smooth muscle cell down here, adventitious down here. So what has happened, and we don't know why, the endothelial cells are not working. So what this is doing is this is going from step 1, step 2, step 3, step 4, step 5, okay? So the endothelial stopped working. So the first thing that happens is large molecules cross into what we call the elastin layer beneath the endothelial cells. So this whole thing is the intima, but remember you have the intima and you have the basal elastin layer underneath it. And so what happens is the LDL goes through the intima and starts to build up in that elastin layer. And the endothelial cells undergo something called oxidation, and we'll talk about that in a little bit. The endothelial cells undergo oxidation, and those endothelial cell molecules change. And so that's why you see the white, and then these little green dots start to show up. So what are those green dots? These are immunoglobulins and immunoresponse that also cross into that tissue space. And it indicates to the white blood cells and to the rest of the immune system, something's weird here. You have these oxidized lipoproteins. Okay? Lipoproteins come in, and when they become oxidized, all of a sudden the body says, that's weird. Lipoproteins aren't supposed to be in this molecular shape. They're not supposed to be oxidized. And so your body starts to allow these immunoglobulins and these other targeting molecules to start to build up in here as well, because remember, the intimal layer has an increased perfusion, so they can go right through that intimal layer, and it starts to target these oxidized LDLs. Again, LDLs aren't supposed to have this extra oxygen molecule on it. It's weird, and so the body says, that doesn't belong here. That's strange.
So are they markers, or are they destroyers?
They're markers. They just build up, and they tell the body something weird is happening. So what does that do? Well, then these monocytes, white blood cells, are drawn to that, and they attach to the endothelial cells. And remember, at this point, what have the endothelial cells turned off? Usually, well, not permeability. Usually, white blood cells, can they attach to the endothelial cells? No. So the monocytes, which are white blood cells, normally cannot attach to the endothelial cells because they produce an anti-leukocyte attachment chemical. But now that the endothelial cells are no longer functioning properly, guess what can attach to them? White blood cells. So white blood cells are drawn by all of this weirdness that's going on underneath here. And what are you noticing is happening to the thickness underneath that endothelial layer? What is happening to it? It's getting thicker. And so those monocytes attach, and when those monocytes attach, the endothelial cells are like, yeah, something's happening back here. Something's wrong because they're not working right. The endothelial cells are dysfunctional. They're not working right. So rather than keeping the white blood cells, these monocytes, outside of the cell, it allows it in to try to figure out what's going on in here. When the monocytes enter in, they activate and become something called a macrophage. Does anyone know what a macrophage does? It's a Pac-Man. Waka, waka, waka. They're there to eat and destroy and break down anything that doesn't belong there. So the endothelial cells allow that to occur, and those macrophages come in, and guess what they start to eat up?
LDLs.
The oxidized LDLs that have been targeted. See, they're targeting it. Take care of this guy, get rid of him. They start eating those LDL cells, and when they eat the oxidized LDL, they create, believe it or not, pus. They create dead tissue. It kills it off. The whole idea of a macrophage is to surround a invading organism and kill it. And when it kills it, it becomes a pustule type of goo. And the more it eats, the more of that pus builds up into the macrophage till the point that the entire macrophage is now pus-filled. Now, normally what would happen if you had an infection, the blood would come and wash that pus-filled stuff into the lymph nodes, and the lymph nodes would clear it, right? Do you have lymph nodes in the vessel wall? No, there's nothing to clear it. Hopefully they can make it back out of the endothelial cells. They come in, they eat, maybe they can make it, because remember the endothelial cells are still permeable, maybe they can make it out of the endothelial cells. But while they're eating something, what is the smooth muscle cell starting to do? They're starting to grow. Remember the extracellular matrix and the smooth muscle cells are told to grow when there's an injury. Is there really an injury here? No. Is there a hole for that smooth muscle to grow into? So which direction do they grow? That's the only way they can. The adventitial layer is too stiff. It can't go that direction. So the only direction it can go is, you see how this is getting thicker and thicker and thicker? More inflamed? More fluid buildup? Well, the smooth muscles can easily proliferate through the elastin layer into this area, and it starts to grow around all of this pus. And then it solidifies, and that pus is now locked into that cell wall. Like a giant freaking zit. Does that make you feel it?
It's gross.
You have all these little zits inside your vessel. Okay. So we have cell apoptosis. This is just dead cells that are now sitting there. We have these pus-filled macrophages that are going to break down and become just gooey material. Remember, atheroma means gruel. It means fatty gruel. That's because those macrophages break down into a fatty gruel that is now entrapped by the smooth muscle cells that have grown around it. And what did I form in my vessel? I now have a bump. That's the step-by-step process of atherosclerosis starting to form. Isn't that great? All because the intima thought it was injured. Let the LDL in. LDL is oxidized. These immunoglobulins said, hey, something's going on here. Called the white blood cells. White blood cells shouldn't attach to the endothelial cells, but the endothelial cells are injured and said, yeah, come on, attach, something's going on. They enter in. They do their job. They eat up the oxidized LDL, which isn't supposed to be there. They munch them up. They contain them, pustules, into those macrophages. They just keep munching. As long as there's oxidized LDL there, they keep munching. As they're munching, the smooth muscle cell starts to grow, and it encapsulates and captures them. And then other cell material dies underneath within all this tissue, and the endothelial cells start functioning again, and you have a little bit of a bump. Now the bump isn't very big to begin with. Let's see, do I have? At first, that bump, you just see, if you looked at the vessel, let me pull this up. I will pull up a picture of what this looks like at first. Here we go. At first, they're not bumps that you can feel. We'll see it in a second. That's not what it looks like. In the very early stages, I was there for a second, come on. You get these little yellow discolorations in the vessel, that's called a fatty streak. It's called a fatty streak because it looks like a streak of fat, right? That's the early stages of the atherosclerotic plaque. It's not a plaque at this stage because it's not a bump. All it is there's not enough macrophage or not enough of this organic material, this necrotic material, that's what I'm looking for. It's not enough of this necrotic material built up underneath the tissue space. Here's my media, here's my intima. There's not enough necrotic tissue to bulge it out yet, but you can see it through the vessel. And you see these little yellow streaks indicating that's where this has started to occur. And over time, as that necrotic tissue grows, and as the smooth muscle grows around the necrotic tissue after being injured over and over again, it starts to build up more and more over many years until it becomes purple.
What if you're ending up bobbing
They just, as you can notice, they just kind of, they're there to target, and once they're targeted, they just don't enter in anymore. They're just broken down by the tissue space.
So macrophage after eating the oxide LDL, they're gonna like undergo apoptosis?
Yep, and so this is what is happening here.
Oh, okay.
So they entered, they ate the LDL, and they start to look like that.
This time white?
Yep, they're white. They're pus. It's basically pus.
Oh, okay.
That's what pus is. Pus is macrophages that have consumed organic invading material.
Mm-hmm.
And basically what happens is the white blood cell contains them, dies, and then what should happen is the blood supply or the lymph supply pulls it away from the infected place and breaks it down even more. It can't be pulled away, so it just gathers. And over time, this keeps happening over and over and over again, and you notice that there's a little cap that starts to form over that. And eventually what can happen is that cap can get so thin that if it bursts, there's so much necrotic tissue here that when that cap bursts finally, some of that necrotic tissue leaks out, and when blood hits necrotic tissue, guess what blood does almost instantly? Clots instantly. It's a zit inside your vessel. Congratulations. How does that make you feel internally? You know, they say beauty's on the inside. Not always. Okay? These are tiny zits, basically, that are building up in your blood vessels. And if the cap gets too thin and it ruptures enough, you're going to form a blood clot at that space instantly. And that's what causes the stemming. Because that plaque is finally ruptured open, that necrotic tissue is exposed to what we call frank or just fresh blood. Fresh blood will clot, and so the whole lumen clots off. That's how fast blood will clot around necrotic tissue. And that's what kills you. We'll get to that later. So this is kind of what occurs. So you have foam cells in the fatty streak. So let me go back to that. Your book uses that term a lot. These white cells here are called foam cells. Why do you think they're called foam cells?
They're like foam.
Yeah, they look like foam. They look like, pus looks kind of like foamy. They're called foam cells. And foam cells combine to make fatty streaks. And then when you have a fatty streak, what happens over time is all of this. Cytokines are building up, which tells smooth muscles to migrate. Endothelial function builds, increasing platelet-derived growth factor, which causes smooth muscles to proliferate. Platelets start to thrombose. Thrombin starts to produce chemicals that causes smooth muscle to proliferate. So when you start forming those fatty streaks, guess what's going to happen to the smooth? Have you noticed what's happening to your smooth muscles? What do all these chemicals cause the smooth muscles to do? Grow. So as soon as you damage the endothelial layer, as soon as the lipoproteins oxidize, as soon as the macrophages come in and start breaking down the lipoproteins, the cytokines from the from the foam cells causes the smooth muscle to start to grow around it. When the endothelial cells are injured, they release something called platelet-derived growth factor that encourages the smooth muscles to grow. The decrease of nitric oxide and the activation of thrombus creates these chemicals which will cause the smooth muscle to grow. Is there any way foam cells are going to make it out of this vessel wall? As soon as foam cells start to form, the smooth muscle grows very rapidly around it, trapping it in. Okay, so we had a very good question asked. We'll get to that here. We'll do it this way. Okay, we had a very good question asked. And that very good question asked is, how can we injure the endothelial cells without cutting it? We call this the response to injury theory. Sometimes you'll hear it called RTI theory, response to injury theory. And this is the theory we worked on for many, many, many years until we realized this isn't always the cause. What this theory basically states is that endothelial injury was required for plaque atheromas. Or I should say for arterial, not plaque atheromas. That's plaque. For arterial atheromas. Okay. Or plaques. In other words, if the endothelial cells stay healthy and are not injured, what should you not form? You shouldn't form plaques. Okay, that's the theory that we still is a primary theory, although it's not the only theory anymore. It's still a primary theory. And so we say if we have endothelial injury, we will have plaque formation. Another way to say this is endothelial failure. So sometimes you'll read texts and they say endothelial failure. That's the same thing as endothelial injury. And so the question always asks, well, how can you injure the endothelial cells inside your body without cutting? Shear force is the force of the blood moving in your blood vessels. Our arteries are designed for moderate shear force or moderate energy of blood motion. However, anything that would increase pressure or flow, especially people with hypertension, they are more likely to form atherosclerotic plaque. The higher your blood pressure, the more force of that blood traveling in your vessels, the more likely you are going to damage that vessel. The best way to explain shear force is its friction against your vessel wall. Even though you're thinking, oh, it's just a fluid, to the small endothelial cell, those red blood cells and platelets and white blood cells pushing against it at a high pressure, at a high rate of speed, will create a lot of friction and could damage the vessel wall, which is why vessels are designed to, when pressure increases, what are vessels designed to do? Dilate to try to prevent shear force. Okay? They only can do so much. Turbulent flow, what does that mean? Oh.
Like it's not smooth.
It's not smooth. It is, remember, most of our flow should be laminate or laminar. So normally our blood flow flows in a laminar manner, which is the blood in the middle of the vessel stays in the middle of the vessel, the blood on the edges of the vessel stay on the edge of the vessel. And it's very laminar. When this occurs, all the pressure is faced forward. Yeah, there is some friction on the vessel walls. That is true. There is some friction against the vessel walls. But all the pressure is faced, all the energy is faced forward. When we have turbulent flow, that's flow that is now mixing. The same flow that causes murmurs or bruits, the sound. When blood mixes and is forced to change direction, you notice now that the force of the flow, when it's not laminar anymore, is no longer facing forward, but it is now turned to face to the wall, where it will then bounce off, hit the wall and bounce off, and hit the wall, and it'll start to twist. Okay, and that slamming against the vessel wall will significantly increase the shear force against the wall. What causes turbulent flow? What's that? Not so much, because they're close. Yeah, narrowings. A point of narrowing will cause, a point of narrowing then getting larger causes turbulent flow. So for example, if I have a vessel that does this, the blood will narrow, but when then it gets past that narrowing, we get caught in that vortex, it'll start bouncing off the walls and flipping around, causing turbulent flow. So points of narrowing will lead to turbulent flow. What does atherosclerotic plaques create? A point of narrowing, which means once you form an atherosclerotic plaque, you've now created a point of turbulent flow, which means from that point on, that point of atherosclerotic plaque will do what?
Continue to build.
Continue to build, because turbulent flow leads to endothelial damage leads to atherosclerotic plaque leads to narrowing leads to turbulent flow leads to atherosclerotic or intimal injury leads to atherosclerotic plaque leads to narrowing leads to turbulent flow, which leads to, do you see how it just keeps
Like a negative
propelling
cycle.
Yep, once it starts, it continues to grow.
Why does the vessel not dilate during a turbulent flow?
It will as much as it can, but you've remember, the vessel wall is still here. It can only get so large. Remember, your vessel can accommodate up to a 60% dilatation. Remember, we don't get symptoms until 60%. But as it dilates, you still have a bump there, and you're still going to get turbulent flow. So this is going to continue to grow. The artery is going to continue to dilate, but it can only dilate up to 60% of its original size, and then it's done. That plaque continues to grow during that entire time. It just takes a long time for us to get to that 60% point. And bifurcations. Well, bifurcations is an area where most plaques develop. Why do we form most of our plaques at points of bifurcations? Why is that a common place for plaques to develop?
Because it stops and goes on the sides.
That's right. The blood wants to go laminarly, and it's going to slam right into that bifurcation, which could cause, depending on the amount of shear force, could cause injury at that point of bifurcation, and then it just propels from there. So one of the causes of endothelial failure is shear force. Well, the bifurcation is a point of shear force or increased shear force. If you have high blood pressure, you're putting those points of bifurcation at higher risk. Okay, so just having a bifurcation, if you have normal blood pressure, it's designed to take that. But as your blood pressure goes up, it increases the risk of increasing the shear force, because there's already shear force there. You're just increasing it. So then we say toxicity. So what do we mean by toxic substances? Well, there are several toxic substances that can damage endothelial tissue. Lovelies. So what are some toxins? Nicotine is a direct toxin. Nicotine is a stimulant that forces your blood vessels to constrict, but it is also interferes with endothelial function. So that's why vape pens do not really decrease your risk of cardiac disease or blood vessel disease. Vape pens still have nicotine in them. They're not an improvement for your blood vessels or heart disease. Okay? Nicotine itself can cause dysfunction in the endothelial cells, and it also causes your vessel to constrict. As my vessels constrict, what happens to my shear force? It increases. But if nicotine interferes with endothelial function, what happens to their ability to resist that shear force? Decreases, and now we have vascular disease. Nicotine pens or vape pens do not help. Okay, they're not any more beneficial. Carbon dioxide and carbon monoxide, all high levels of CO2 and any level of CO will tend towards causing endothelial cell dysfunction. High levels of CO2 simply because the endothelial cells do not have the oxygen they need to function properly. And so the cells don't get the oxygen they need, they can't perform their duties, and they go to do dysfunctional action. Same with CO. Increased glucose levels, diabetes, and the problem here is the cells cannot utilize the sugars properly. You don't have the proper insulin to utilize the sugars properly. And so what happens is the vessels constrict very, very small. Do you ever see a diabetic's vessels? Very, very thin. And part of that is the inability to use glucose appropriately. But also that lack of utilization of glucose at high sugar level in your bloodstream causes your endothelial cells also to dysfunction, which is why diabetics have a severely higher risk of atherosclerotic disease. The vessels constrict, the endothelial cells become dysfunctional, higher shear force, the endothelial cells are already not working properly. You are just a basket of atherosclerotic disease waiting to happen if you're not taking care of yourself. And then increased lipid levels, okay? Hypercholesterolemia. It has to be pretty high. So what happens if you have really high cholesterol levels, what happens is you overwhelm the endothelial cells. If you have really high cholesterol levels, the endothelial cells are not able to filter out all the lipids that are trying to cross through the tissue barrier. Remember, the endothelial cells are supposed to be the bouncer. They're supposed to keep the lipids out of the vessel wall. If your lipid levels in your blood is so high, it overwhelms the endothelial cell's ability to resist my brain just went blank, permeability to lipids, and they start to cross on their own. So people with high lipid levels are at increased risk of forming atherosclerotic disease because they overwhelm the endothelial cells. The endothelial cells just can't function the way they're supposed to. So in all of these cases, in shear force or toxicity, in both of these cases, what has happened is the endothelial cells have been rendered injured or unable to function. Okay? There's something that's directly acting on the endothelial cells. Either the shear force has damaged them, or they have been rendered inoperable by some sort of toxic level. We then went back and we found out that this does not explain every single patient we run up against. And we started to scratch our head and say to ourselves, is there another factor that can lead to atherosclerotic formation? So we have this thing called systemic response to inflammation, which is different from response to injury. Systemic inflammation can lead to decrease in endothelial function and increase endothelial permeability. And it's very strange how we noted this. People with human immunodeficiency virus are at increased risk for atherosclerotic and vascular disease, even if they don't have any other risk factor. We've also found that patients with lupus, which is a connective tissue inflammation process, are at higher risk for atherosclerotic disease minus all other familial factors. Interesting. We started to make a connection that there are times when patients don't have any other risk factors that we can point to, but they have this inflammatory disease. The weird one that really threw us is when we did a study on gingivitis. I know this sounds weird, but individuals with severe prolonged gingivitis or inflammation of the gum tissues have a significant increase in risk of atherosclerotic disease. What we have found out is when you have a systemic inflammation that is prolonged, especially a systemic inflammation, an inflammation that can affect any connective tissue and can spread throughout the body, your body releases a lot of bradykinin, a lot of histamine, a lot of immunoglobulins, which will mean that the endothelial cells become more permeable. Now, this inflammation is not an injury. We're not injuring the endothelial cell in any way. We're not making them toxic. Nothing's happening directly to the endothelial tissue. But the circulating inflammatory chemicals cause the endothelial cells to become more permeable. And when they become more permeable, what can cross through them? Lipids. And when lipids cross through them, that also activates the ability for the white blood cells to adhere to them. Because what happens is your body starts to think everything in your body is inflamed, including your blood vessels. So your blood vessels start to allow this inflammatory process to take effect, which will lead to development of foam cells and atherosclerotic disease. So yes, dentist appointments are important. If you want to avoid atherosclerotic disease, there is a direct link there. Okay? So injuring the endothelial cells isn't enough. Sometimes just a systemic-wide inflammation can lead to dysfunction of an endothelial cell, and that can also lead to atherosclerotic disease.
It will, decrease the endothelial cells in the arteries throughout the whole body, not just the heart.
Yeah, we'll talk about that in a second. Yeah, endothelial cells throughout the whole body. So here is my question to you. You asked a very good question. Where's my picture? Okay. So there is a direct correlation between atherosclerotic disease of the heart and atherosclerotic disease in other places of your body. To the point that if you have atherosclerotic disease in your carotids, you're about 80% likely to have atherosclerotic disease also in your heart, in your coronary vessels. If you have atherosclerosis in your coronary vessels, you're 40 to 60% likely to have atherosclerosis also in your carotids. Atherosclerosis does not just form in your coronary vessels. They can form in any artery of your body. Matter of fact, if you're forming atherosclerosis in one area of your body, guess what that usually means?
That is somewhere.
It is also forming in multiple other vessels in your body. Okay? It is not just localized. So why do we see so many cardiac problems, more so, the strokes are pretty big, but more than strokes, more than lower limb ischemia? Why do we see cardiac problems first, generally? Okay, that's one. Your heart's always working, needs a constant blood supply. That's part of it. What's the size of the vessels? They're tiny. So if all the atherosclerosis disease processes grow at the same rate, and you have a big vessel and a teeny tiny vessel, which one's going to feel the effect first? Teeny tiny vessel, which is why myocardial infarctions are usually one of the first primary signs and symptoms of somebody having atherosclerotic disease of any type. It's also one of the most deadly, the next being the carotid arteries. You can see that. So the question then comes up. Start coughing here. The question then comes up, what role does lipids play in atherosclerotic disease? And this is a question that is, I have to be careful on how we explain it because a little bit of understanding is dangerous. You can have somebody with a cholesterol of 500, and you'll see this and you'll be like, why? You can have somebody with a cholesterol of 500 and bring them to the cath lab and you're like, they're going to have atherosclerotic disease, and they have nothing. And you're like, what? And then you have the vegan marathon runner, and this is a true story. We had a vegan marathon runner, quadruple vessel disease needing emergent open heart bypass. His cholesterol level was 210, little elevated. And you ask yourself, what in the world is different between these two individuals?
Genetics.
Okay. Well, that's part of it. The one thing is it's not enough just to have high cholesterol. You have to have high cholesterol, and what has to happen to your endothelial cells?
Break open.
They either have to be injured or dysfunction, okay? One of those two things happens. You can have a lot of cholesterol in your bloodstream, but if it can never cross the endothelial barrier, will you form an atherosclerotic plaque? No. You can have very little cholesterol in your blood, but if your endothelial cells are constantly inflamed or injured, will it cross into the vessel wall and form an atherosclerotic plaque? Yes. So what role does atherosclerosis play? Well, if you have too much atherosclerosis, if you have too much lipid, we just said it can overwhelm the endothelial cells and you'll just start to form it. The endothelial cells are like, I can't hold this all back. It's just like everyone rushing at once. Okay, can't hold everyone back, some will get in. However, endothelial cells aren't enough. Endothelial cells, lipid is not enough. If you have a high amount of lipid, and I can prevent it from crossing the endothelial cells, you should not technically form significant, at least, atherosclerotic plaques. So why do we focus so much on decreasing cholesterol then to treat vascular disease? Why do we say if you have high cholesterol, you are at higher risk of coronary artery disease? It's basically a chance of numbers, okay? So let's say, I love this thing, has anyone heard about the Rush Area 51?
Yes.
Did everyone hear about that on the internet? Where people were joking around, let's get 1 million people at Area 51. It's a secret research base of the US government. And we're just gonna rush it all at once because they can't stop us all. You know, somebody's gonna make it through. Okay, so that's the idea. If you have 5 or 6 cholesterol molecules and you have an injured endothelial cell, 5 or 6 cholesterol molecules can cross and create a little bit of a problem. Does that make sense? If I have 1,000,000 cholesterol molecules and I injure the endothelial cell, what's going to happen in this case?
It will be overwhelmed.
It'll be overwhelmed and I'll get a more of an event. That more will get through. So the reason we put people on statins is not because that cholesterol itself causes atherosclerotic disease. It's just that if you have a high statin level and you create an injury in your endothelial cell, you're going to get more of those. High statin level. My brain's dysfunctioning all of a sudden. High cholesterol level, and you get a small hole in your endothelial cell. That high cholesterol, all that cholesterol will try to get into that endothelial cell, and you'll form a plaque very quickly. Does that make sense? So if I can decrease the amount of circulating cholesterol in your blood, even if I form an injury in my endothelial cell, you'll have less cholesterol get into that space. What's going to happen to the development of the plaque? It slows down. Does that make sense? Also, statins decrease inflammation. And what is one of the leading causes of atherosclerotic disease formation, or what's one of the causes of atherosclerotic disease formation? Inflammation. So statins cause your liver to get rid of cholesterol. Statins also has an anti-inflammatory effect in your body. So I decrease the inflammation, which hopefully means my endothelial cells will stay healthy. I decrease the cholesterol that is floating around so that even if an endothelial cell does become injured, less cholesterol is available to push into that opening and I won't form a plaque as quickly. Does that make sense? However, even if you have low cholesterol, that doesn't mean you're not going to get a plaque. It also depends on the health of your endothelial cells, which is why you can have the vegan marathon runner whose cholesterol is really low and still have atherosclerotic disease, because genetically his endothelial cell and his cholesterol levels, his body just can't facilitate them as well. So it's not just cholesterol, it is an overall health and well-being.
What's the breakdown in the endothelial cells and that you have a problem with?
Usually it's an inflammation process. Think about a marathon runner. What happens after, if you're pushing your body that much, what does your body go through a lot?
Stress.
Shear force and also inflammation process of healing. And if your body does not handle that inflammation process, there's a genetic component to handling inflammation processes, it can become complicated. He also was a vegan, which means his diet isn't high in proteins, which means that proteins are necessary for moderating that inflammation process. So there's lots that's tied into it. But the point is, it's not just the cholesterol. Cholesterol is a portion of it, but the health of the endothelial cells is the most important thing. What is the best way to avoid atherosclerotic disease? Was that? Don't run. No, that's not it. But that's why they also say walking is sometimes safer than running. What? Exercise and diet. Those are the two most important things.
Salads.
Decrease cholesterol in your diet, increase healthy proteins in your diet because they have anti-inflammatory effects, except red meat, but I'm a steak guy, so. But increase healthy proteins, decrease fatty, high cholesterol, high sugars like rices and pastas, and exercise. But not high endurance exercise, because high endurance exercise, especially if you don't have a good anti-immune system or immune response system, the inflammation process sometimes can hurt you. You just need a good, healthy exercise regime Get your heart rate up, get your body moving, get the blood moving healthily through your blood vessels, eat a good meal. If you form atherosclerotic disease in your arteries, can it ever go away?
No.
No. They can solidify statins, help them harden a little bit, but they're always gonna, there's nothing that goes in and removes this from the vessel wall. And we'll continue to talk about that more next week when we talk about ischemia and atherosclerotic disease and risk factors, what we call modifiable and non-modifiable risk factors for atherosclerotic disease. And we'll talk about that next week. Sounds good? Let's take about 20 minutes. When we come back, we will talk about electrophysiology.